Hey everyone, welcome back to my channel. I'm Sheila G, the PAC, and this video is going to be all about pseudofolliculitis barbae, otherwise known as razor bumps. In this video, I'm going to be talking about how the condition happens, how to treat it, and also some really important shaving tips. If you find this video helpful, don't forget to like, comment, and subscribe to my channel for all things dermatology. Let's get started. Pseudofolliculitis barbae is a chronic inflammatory condition that involves ingrown hairs. Unlike folliculitis, that is inflammation and bacteria of the actual hair follicle, pseudofolliculitis barbae is inflammation that involves a false follicle, such as an ingrown hair. The condition is more common amongst those with very thick, coarse hair, and it's often triggered by shaving. So we tend to see it more often on the face, specifically the beard area, the anterior neck, under the jaw, but it can affect other places that are frequently shaved. The condition most often affects African American, Asian, and Hispanic men, but it can affect all races. Those who are in professions that require frequent shaving, such as police officers, firefighters, and military personnel, tend to have the condition more often because of that requirement. Now, although it is not nearly as common in females, women who suffer from PCOS, or polycystic ovarian syndrome, who have hirsutism, which is abnormal facial hair growth, who shave that area frequently, may also develop pseudofolliculitis barbae. There's also some genetic factors that are involved in the development of this condition as well. As far as clinical features, itching and/or pain may develop 1 to 2 days after shaving, followed by the development of papules, which are inflamed bumps, and pustules. And those pustules are secondary to bacteria in the skin. The newer bumps tend to be more red and inflamed, while older, healing bumps tend to be more purplish in color, just overall hyperpigmented. The condition can also lead to significant scarring, keloids, hypertrophic scars, due to that chronic persistent inflammation. So let's talk about what's actually happening on the skin when this condition develops. So those who get this condition tend to have curved hair follicles, which give rise to tight, curly hairs that are often pretty thick. So after a close shave, that emerging hair starts to curl downward, and then it penetrates into the skin next to the hair follicle, and that's called extrafollicular penetration. And that leads to an ingrown hair, which triggers a foreign body response in the skin, leading to significant inflammation. There's a second mechanism by which ingrown hairs develop called transfollicular penetration. And what that means is that when the skin is pulled or stretched while shaving, that hair, when it's cut, recoils back into the hair follicle. And then when it starts to grow, it starts to curl underneath the skin. So think of it like a rubber band. I have a hair tie here. So when the skin is pulled during shaving, the hair is going to be stretched with the razor, and then once it's cut, it recoils. So it bounces back into that hair follicle. So this leads to another ingrown hair, but more so underneath the skin. And again, that leads to a foreign body reaction, leading to inflammation. And then there's something called perifollicular hyperkeratinization. Fancy word, but basically that means that there's a buildup of dead skin cells around the hair follicle, and that contributes to the bumps that we see in the condition. The reason why I'm bringing that up is because it's important when discussing treatment, as chemical exfoliation is a necessary step to control it. So now let's talk about how to treat the condition when it's actively flaring, and then we'll talk about how to prevent flares, as well as some really important shaving tips. So when the condition is flaring, topical and oral antibiotics may be prescribed to calm down inflammation and control bacteria on the skin. More specifically, tetracycline antibiotics such as doxycycline or minocycline are often prescribed, as they also reduce inflammation. As far as topical antibiotics, more commonly we prescribe clindamycin, either solution or lotion, and erythromycin. For more localized inflamed bumps on the skin, a steroid solution can also be injected into those areas to more quickly reduce the inflammation. As far as some other topicals that help control the inflammation and potential scarring on the skin, topical retinoids such as tretinoin may be prescribed. But we're also going to go over some over-the-counter treatments that can be used to treat the condition and prevent it, and then we're going to talk about a really solid regimen that you can implement. And now prevention. So ultimately, the best way to prevent this condition is to stop shaving altogether. But understandably, that's not always an option, especially for those who are required to shave. So let's go over some really important shaving tips to try to mitigate the risk of flare-ups as much as possible. Number one, do not use any razors with multiple blades. So that first blade is going to stretch the hair while the second blade is going to cut it, which again leads to that increased risk of that hair retracting into the hair follicle and then leading to an ingrown hair. If you have a razor that has more than 2 blades, yes, you're gonna get a closer shave, but think about it. The more blades passing over that same area of skin is gonna lead to more inflammation and it's gonna compromise that skin barrier. So we often recommend either an electric hair clipper or a double-edged blade. Now these can sometimes be a little bit more pricey, but for this condition, it might be worth the investment depending on how severe it is. As far as prepping the skin, you definitely want to use warm water to allow for swelling into that hair. So when the hair swells, when it's cut by the razor, it's going to leave more of a blunt edge, which is less likely to penetrate into the nearby skin as opposed to a sharp edge. Now, something that I recommend as part of the routine is that prior to shaving, use like a salicylic acid cleanser, which is going to help break up a lot of the dead skin cells. Remember, we talked about the dead skin cells surrounding the hair follicle, and then use warm water to cleanse the skin and warm water on a towel to pat the skin to allow for that hair swelling. Then you want to apply a good calming shaving cream or gel. A couple that I recommend is the Clinique for Men Shaving Gel, the Aveeno Therapeutic Shaving Gel, and then the Vanicream Shaving Cream. For reasons that I explained earlier, do not pull or stretch the skin, and also, as you may have heard, always shave with the grain, not against the grain. So it's also been shown that shaving more frequently may actually reduce flare-ups, and the thought behind this is that if you allow that hair to grow a little too long, you're at higher risk of that hair going in and penetrating into the nearby skin. So if you shave a little bit more frequently, you offset that risk. So then there is aftershave, which has been shown to help. You want something that's very calming for the skin. So a couple that I recommend would be the 10 Skin solution, as well as the Kiehl's aftershave. So that's how you want to shave. If you have this condition and you want to maintain the skin or continue treating the skin, there are a few other things that you can implement into your skincare regimen beyond just the shaving routine. And one thing that I would recommend is to implement a chemical exfoliant such as a alpha hydroxy acid, and a good one is glycolic acid. So when starting out, you want to implement something like glycolic acid maybe 2 to 3 times a week, depending on how sensitive your skin is. But glycolic acid, again, is going to break up a lot of the dead skin cells that are trapped around the hair follicle. It's going to help smooth the skin and also treats hyperpigmentation that's left behind from the condition. Another thing that glycolic acid has been shown to do is break up the sulfhydryl bonds that are within the hair follicle. And so what that does is it reduces the curvature of the hair, making it less likely to curl up and penetrate the skin. So I would suggest using a glycolic acid serum or solution a couple times per week at nighttime after cleansing the face. A really good one, again, is the Ordinary's glycolic acid solution. This is wonderful stuff. Now, a more definitive treatment option for this condition is laser hair removal. And these lasers target melanocytes within the hair follicle, and that generates heat, which ultimately destroys the hair follicle. And so it normally takes anywhere from about 4 to 7 sessions to get the best results. Now, the type of laser that is used is very dependent on the patient's skin type. And you have to be careful with this because some lasers may cause hyperpigmentation in certain skin types if it's not the correct laser. So for those with darker skin types, the best laser for laser hair removal is the ND YAG laser. So the use of depilatories, which are creams or lotions that dissolve the hair, such as Nair, may work, but they lead to a lot of inflammation, so it's typically not recommended. So there you have it, an overview of a very frustrating condition, Pseudofolliculitis Barbae. Thank you guys so much for watching, and I really hope that you found this video helpful, and hopefully these tips and tricks help you. As always, don't forget to like, comment, and subscribe to my channel for all things dermatology, and I'll see you next time.